Good morning. It's a great day to be a Titan. It's also a great day to learn about our diagnostic decision tree for reading that helps us understand how screeners and diagnostic assessments lead to the identification of the lowest deficit skill for a scholar. The diagnostic decision tree is a tool for educators to use with students in grades 3 and above. The decision tree helps us as educators determine where intervention needs to occur for students in order to comprehend and read at grade level. When working with students in grades 3 and above, we will first look at comprehension and work our way all the way down through phonics and on to phonemic awareness. However, in grades K2, we would start with phonemic awareness and work our way up to determine where gaps exist for a student. If assessments indicate that a scholar is meeting grade level benchmarks in reading comprehension, then we would continue with strong Tier 1 instruction, differentiating as needed to offer remediation and enrichment in order for scholars to master grade level essential standards. However, if assessments indicate that a scholar is not comprehending on grade level, then the first step would be to look at the scholar's passage reading fluency. This can be done with a formal measure such as MAP fluency or Dibble's oral reading fluency. It can also be done informally. The easiest way to informally assess fluency is to take a time sample of students' reading and compare their performance, their number of words read correctly per minute, with published oral reading fluency target rate norms. When conducting 1 minute measures, it's also important to ask the student to retell what they read so that you can confirm that they actually understood the information they were reading. If students perform at grade level on passage reading fluency, the needed intervention would fall in the category of vocabulary and comprehension strategies. If they perform below grade level on passage reading fluency, then one would want to look at their ability to recognize words out of context. For this, assessments such as the San Diego Quick Check or core assessments could be used. These assessments are lists of frequently used words seen at grade level. These word recognition assessments check how large a student's sight word vocabulary is. If they're able to read fluently and quickly within the word recognition assessments, then we should work with them on spelling and fluency, in addition to vocabulary and comprehension strategies, to firm up their skills in order to become more confident in reading comprehension. If they are low in word recognition, the scholar should be given a diagnostic phonics assessment to determine where in the phonics continuum and at what skill level the student needs intervention. If the student has mastered phonics skills, then we would work on spelling and sight word recognition and fluency. If skill gaps do exist within their phonics, then we would need to assess their phonemic awareness. Because we know if there are gaps in phonemic awareness, we know phonics will not stick. And this is where the intervention will need to begin so we can move them upward in other components. Thank you so much for learning about our diagnostic decision tree for reading today. And please let the curriculum team know if you have any questions. Have a great day.